This mini lecture is going to cover prenatal development. So after conception, where the sperm and the egg or the ova meet and join to become an embryo, the germinal period is what begins. So this begins at conception and it continues through implantation, which is about 14 days. And so you can see that conception actually happens in the fallopian tube. So the egg's released from the ovary, goes into the fallopian tube, the sperm swims to the egg accepts one sperm, conception happens, and then the cilia along the fallopian tube help the egg move down into the uterus, where it burrows into the wall of the uterus and implants, and that takes about 2 weeks. Only about half of fertilized zygotes or embryos actually survive this period, but often a woman wouldn't know if they had gotten pregnant and miscarried in this period because it would happen during the regular menstrual cycle. So from week 3 to 8 is the embryonic period. This is when the placenta forms. Cells continue differentiation, which just means that they are becoming unique parts of the embryo. So all of the different components, the heart, the nervous system, skin, bones, all of those things, all of the cells start kind of in the same place and they have to all decide what they're going to become, and that's differentiation. And you see two ways that growth is occurring. So you have cephalocaudal development, which means that there is more development from the head first, and then it moves down through the body. So in the image there, you can see how much bigger the head of the embryo is. And then there's also proximal distal development. So the trunk develops before the limbs. And if you can look and see how tiny the little arms and legs are of that embryo, you can see that the focus of the growth is the trunk or the body first, and then it goes out. And in this stage, there's about a 20% rate of spontaneous abortion or miscarriage. So there's quite a few embryos that don't make it out of the embryonic period. If they do, they move into the fetal period. And this is where a lot of the things that make an embryo or a fetus at this point look human, right? So we go from something that could turn into a lot of different looks like it could turn into a lot of different species to something that looks human. And a lot of the kind of refining of development is happening during this period. And so all of the major structures continue to develop. All of the body parts are become there by the 3rd month. They become able to sense light and sound during this period. Once they begin to have cycles of sleep and wakefulness, they practice breathing with the amniotic fluid. And at about 24 weeks, a fetus is considered potentially viable, which means if they are born early, they have the chance of surviving. Typically before 24 weeks, they're not considered viable, and they depend on the mother for survival. At 24 weeks, they'll still need a lot of medical intervention, but if they're born early, their chances of survival start to increase as age happens. A lot of important brain development's happening at this period. Fat develops. And so one of the things you'll notice with premature babies is they look pretty skinny and scrawny compared to a full-term baby, because fat is one of the things that happens in the last weeks of pregnancy. And at about 36, 37 weeks, in fact, the full term is considered 37 to 40 weeks, the baby begins to be ready to be born, and so that it could survive without a lot of the risks of earlier delivery. And then, once they hit 40 weeks, they kind of run out of room to grow, and delivery becomes imminent. And you will learn more about delivery in the next chapter. So sometimes more than one baby develops in the womb. And so we're going to limit it to just twins, but you could also expand this to triplets, quadruplets, quintuplets, sextuplets, and beyond. But there's 2 types of multiples. We'll call them twins in this instance. So monozygotic come from the same fertilized embryo, right? So that embryo divides and makes 2 identical copies of itself. And depending on when that happens, different outcomes happen. But you can see in the image there, those two little girls are identical twins. They look alike. Now, on the other hand, if you have multiple embryos, so different eggs and different sperm combined, but during the same pregnancy, that's considered dizygotic. We also call that fraternal. And so you can see those are two unique human beings that are no more genetically similar than any two siblings born at different times. And you can see an image there of a girl-boy dizygotic or fraternal twins. There are some things to be aware of that affect prenatal development, and one of those are teratogens. And teratogens are important because these are things that, in general, we can control exposure to. So it's important to be aware. So one of the things to be aware of is the timing is important. And you can see in that image there that different parts of the body are developing at different parts of prenatal development. So the sensitivities to teratogens changes as development happens. So certain things are more vulnerable at the times that they're developing. And some of that development happens before many women even know they're pregnant, which is problematic because it's hard to avoid a teratogen that may not be dangerous to you as an adult human being when you don't even know you're pregnant. The amount of exposure is also really important, as well as the number of teratogens. So a fetus might be resilient to one, but if you have 2 or 3 going on, they may not be able to have the same resiliency. Genetics, as we mentioned, with the predisposition to pesticides, for instance, genetics plays a role. Is that embryo more genetically predisposed to be sensitive to that teratogen or to be more resilient against it? And is whether or not they are male or female. So we see that there are more impacts of certain disorders and birth defects on males, and we think that has to do with the fact they have less genetic material than a female embryo does. So we've looked at 4 different categories of teratogens. So things like environmental or physical teratogens, like a sauna or hot tub, or an infection that makes the woman's body get hotter, which kind of is associated with neural tube defects, spontaneous abortions, and cardiovascular abnormalities. There are metabolic conditions that affect the pregnant mom, and those can affect development and function of the body. So things like malnutrition, diabetes, and thyroid disorders can all cause issues with the nutrition the embryo receives. Infections like the rubella, herpes simplex, and syphilis can cause issues. So things that might not be dangerous for an adult that's not pregnant to deal with can be catastrophic to an embryo. It may cause the embryo to die and be miscarried, or it can cause severe birth defects. And then there are drugs and chemicals. Those are the ones we often think of teratogens. So things like radiation, heavy metals, insecticides, both prescription and over-the-counter drugs. So there are things that are safe to take when you're not pregnant that are really dangerous for embryos and fetuses. Obviously, illicit and recreational drugs, alcohol, cigarettes, other forms of nicotine, caffeine, and even some vitamins. So if we have too much of certain vitamins, it can cause issues. So some of the other parental factors that can influence prenatal development. Let's look at mom first, or the maternal. So age is important. When you reach 35, they consider you of advanced maternal age, and you are more likely to have certain issues, including issues with fertility, high blood pressure, diabetes, miscarriage, placenta previa, needing a C-section, having a premature baby, or experiencing a stillbirth, or different genetic disorders or birth defects. And part of that is the fact that when you are in your mother's womb, your eggs are already there. You've had those eggs your whole life. And so as time goes on, age does not help your egg quality. But it is important to note that there are some positive influences, especially some environmental things of, maybe having better education, a more stable income, stronger family focus, those types of things we've also found. So it's not all bad. We also look at teenage pregnancy, and so teenagers are more likely to have pregnancy complications, including anemia and high blood pressure. That's especially so for mothers under 15. There is a higher risk of premature delivery, low birth weight, and other serious health problems, which have their own negative consequences. And part of this relates to the fact that teenagers are less likely to get the high quality prenatal care that they need and may engage in some risky behaviors that don't lead to good health outcomes for their child. We also have gestational diabetes, which is when your body has too much glucose or sugar in the bloodstream. And so women that are under regular prenatal care get screened for gestational diabetes. And if it's untreated, it can cause issues such as premature delivery, stillbirth, breathing problems at birth, jaundice, or problems with low blood sugar. And it can also cause babies to be much heavier as well. High blood pressure is a risk, and so that's also referred to as hypertension. And so there are two. There is the form that's just caused by the pregnancy, and then there's high blood pressure that you had outside of being pregnant. So it's just a chronic issue for you. And so it's fairly common. 8 in every 100 women are estimated to have experienced it. It can cause issues with premature birth and low birth weight, placental abruption, which is where the placenta comes away from the wall of the uterus. And if a baby's not delivered and viable, that will cause death. And then they can the mother can develop preeclampsia, which can be fatal to the mother. Rh disease refers to a protein that's found in blood. So a majority of people are Rh positive, meaning they have the protein. But there are some people that don't. I happen to be one of those people. And so I don't have that protein, but I could have a baby that does, depending on the genes of the baby. My body won't like being exposed to that protein. And so it will cause me to reject my immune system to go into thinking there's some sort of foreign substance that it needs to take care of. This doesn't cause an issue with first pregnancies. It causes an issue with later pregnancies. And so mothers are treated if they are Rh negative to keep that from happening. Weight gain is also really important. So often there's this misunderstanding that, we're eating for 2 when really you only need about 300 extra calories while you're pregnant. And depending on what your weight is when you get pregnant affects how much weight you need to gain. So if you are underweight, you need to gain extra weight. If you're a healthy weight, you're looking at 25 to 35 pounds. If you are overweight, maybe 12 to 25. And if you were obese, probably 11 to 20. And there are instances where women that are overweight or obese make such positive changes in their diet, they actually lose weight during pregnancy, but that shouldn't be a goal. I'm not advocating losing weight during pregnancy, but often health changes can help mom become healthier during pregnancy too. Stress is really common during pregnancy, but high levels of stress can cause premature delivery or a low birth weight baby. And again, that causes issues and risks for them. Depression is also a risk factor, and that has to do with your genetic predisposition. So if you're more likely to experience depression outside of pregnancy, you're also more likely to experience depression during pregnancy. And about 13% of women need to actually be given an antidepressant during pregnancy. And you need to make sure that the antidepressant you're on is safe for pregnancy. We also know that there are paternal factors or factors from the father that affect prenatal development as well. So the age of the father we're discovering is actually an important factor as well. So we give men a few more years than we give women. And we talk about over 40 causes an increased risk of miscarriage, autism, birth defects, achondroplasia, and schizophrenia. And they're thinking that that's due to some increased risks of chromosomal mutations and issues as men get older and produce sperm later in life. But again, the risks are pretty small, just like with women of advanced maternal age. They're also more likely to work in environments where they're exposed to hazardous materials, which would be a teratogen for women. For men, it just could be something that can cause genetic mutations. So they talked about petrochemicals, leads, and pesticides as well. And men are more likely to be a source of secondhand smoke for developing offspring, and smoking by the mother or around the mother is not good. So prenatal health is monitored by what we call prenatal assessment. And so most women at some point in their pregnancy receive an ultrasound, and as well as some kind of just maternal things, so blood and urine analyses and kind of some screenings to make sure they're healthy. But that ultrasound is one of the main screening tests that actually kind of gives us a picture of fetal health. And so they use sound waves. They bounce sound waves off to create a picture. Sometimes it's easier to interpret than others. And early in pregnancy, they actually do transvaginal ultrasounds, which is done through the vagina because the embryo is so small. That gives a better picture. Later in pregnancy, they do it through the abdominal wall, which is a transabdominal ultrasounds. They can check for growth, defects, problems, help determine the age of the fetus, where the placenta is at, what position the fetus is in, heart rate, the amount of amniotic fluid, and in the instance of multiples, whether or not there's more than one fetus or embryo. And then ultrasound is also used in more invasive assessments or testing. So if there is concerns about a specific disorder or some of the screens look questionable, women can choose to have an amniocentesis or a chorionic villi or villus sampling. So they use the ultrasound to determine where the baby is. For the amniocentesis, they go through the abdominal wall to collect some of the amniotic fluid and then look at the fetal cells that have been sloughed off into the amniotic fluid to see if those are genetically normal. That happens a little bit later in pregnancy. And then chorionic villi sampling, they actually go in through the vagina and take samples of the placenta. And so it doesn't go into the amniotic fluid. Both of those have risks of miscarriage, so they're something that I think are typically reserved for when there are risk factors present that either could cause a major health concern, or just something that people need to be aware of so that they can be prepared to treat it or deal with it after delivery. There are some complications of pregnancy that I think are important. So lots of women experience things that are minor, like what we call pregnancy-induced nausea, which is commonly referred to as morning sickness, but it doesn't just happen in the morning. Also things like heartburn, hemorrhoids, backache, legs cramps, insomnia, constipation, shortness of breath, or even varicose veins are very common and are minor, but there are some more serious things. So here are a few of those serious things. So hyperemesis gravidarum is severe pregnancy-induced nausea, and often women who experience this need to be hospitalized to stay hydrated and to have enough nutrition to allow the embryo or fetus to grow. So medication may also help with that. An ectopic pregnancy happens when the embryo doesn't make it into the uterus and starts to develop in the fallopian tube. And if that continues to happen, the fallopian tube will rupture. That's not a viable pregnancy because there's not room for the embryo to grow and no place for the placenta to develop. And so those need to be taken care of through medication, or if caught too late, surgical procedures to actually remove the embryo in the tube. Spontaneous abortion, which is also miscarriage, is another complication, and there are different risk factors for that. It's actually fairly common, unfortunately, to experience, and depending on the timing of it, you may need medication or procedures to help with that process. Preeclampsia, which I mentioned earlier, also noticed as toxemia, is a really high blood pressure and causes a leakage of protein into the urine, which is a kidney issue. Swelling happens. It's the most common complication of pregnancy. It can cause seizures, which then it becomes eclampsia, which is the second leading cause of maternal death in the U.S., so it's really important to monitor this. It's also the leading preeclampsia is also the leading cause of fetal complications, so often they try and help keep the blood pressure lower, and if they can't control the blood pressure, the only way to treat preeclampsia is to deliver the baby. And then the worst outcome, obviously, of pregnancy would be maternal mortality, or the mother dying. And approximately 1,000 women around the world die each day. And the rates are higher in sub-Saharan Africa and South Asia. But thankfully, there's been a decrease in rates worldwide. And then the last thing I want to talk about is when there are fertility issues that cause prenatal development to need a little bit of help to happen. So 10 to 15% of U.S. couples experience infertility. And then there are also situations where families experience fertility issues due to their composition. So if there is a single woman or man, or two men or two women, they don't have the genetic material available to create an offspring by themselves. So there's male factor infertility as well as female factor. Often it's a combination of both, so it's about a third each. So a third of the time it's a male factor, which has to do with sperm. Female factor, which can be caused by a lack of ovulation, pelvic inflammatory disease, etc. That's another third of the time. And then the rest of the time, it's a combination of both. So there's some different options for building your families. So you can go through assistive reproductive technology, commonly referred to as ART, or ART. The least invasive is intrauterine insemination, which is where you just put the sperm directly into the uterus, so it doesn't have to go through the vagina and cervix, so you get it kind of one step closer. If that's not effective or not indicated medically, you can go with in vitro fertilization. This is the petri dish or the test tube common conception of that. So the mature eggs are taken from mom, sperm is taken from father or a donor, combined into a petri dish in the lab. Embryos are then created. They are grown for 3 to 5 days, and then they're transferred into the uterus to see if a pregnancy can develop. Sometimes you need gametes, so sperm or eggs from someone that's not the parent, the intended parent. So that's donor gametes. There's also donor embryos. So these are embryos that have already been created in ART for another couple or another person, and those could be donated to someone else to develop a pregnancy. And then you can also use surrogacy, which is where a woman carries the baby for someone else. So, and then there's also the way to building your family, even if you don't experience infertility, is adoption. And so that can be done through foster care, that can be done privately, that can be done through public agencies, can be done in the U.S., and it can be done in foreign. So the images on the slide here are a gay couple with their surrogate and their newborn daughter, and a single mother that pursued adoption at her finalization hearing. So I hope this helps you understand where we all came from, right? Way back when we were in the womb, and how our prenatal development happened.